that I think the patients, especially, would like to know before the month of Ramadan. Some of them may want to know whether is it safe for them to exercise? Should they be exercising? Can they exercise? What is the best time to exercise, and what kind of exercises can they do, and what precautions should they take? So for that, I just want to briefly discuss regarding some pertinent aspects of exercise. So I think it's important we know that to know that what happens when we exercise. We've got an acute response which occurs in these following systems, basically to help the body increase and meet the demands of the increased energy and oxygen needs as we transition from rest to exercise. But we also need to bear in mind these very responses that help the body transition from rest to exercise can also be a trigger for acute cardiac events. So that's the reason why, especially in a previously sedentary subject who may not have any illness or comorbidities, still it's not advisable for them to perform sudden vigorous activities, because as you can see from here, the relative risk of an acute cardiac event is actually quite high with each episode of activity. Now, but as we continue to perform exercise on a regular basis, you can see that the risk actually reduces. Now, coming to the chronic adaptations, if we were to continue with our exercise program and over a period of 6 to 12 weeks, there will be certain adaptations that take place in the following systems. I will not be able to go into detail in this, but basically these serve to increase our body's capability and efficiency for us to be able to continue with this exercise on a long term and basically to derive the benefits from this. Okay, the next thing I would like to talk about is the impact of skeletal muscle mass on metabolic health. Now, most of the time, because when we talk of exercise, I think a lot of them actually think of aerobic exercise, which definitely is one of the main important aspects, but a lesser known or lesser appreciated aspect is actually the role of our muscle mass in metabolic health. So as we know, muscle is a major organ of insulin-mediated glucose uptake. And when we do resistance training, strength training, it helps, there will be secretion of myokines, and these actually help to, they have a beneficial effect on both glucose as well as lipid metabolism. And physical inactivity by itself has a catabolic effect on muscle tissue because amino acids will be less able to synthesize protein with less activity. Now, the last aspect is sarcopenia. Sarcopenia is basically loss of muscle mass and strength. It is associated with aging. That means there will be sarcopenia as we age. In fact, from the age of 30, most of us would probably lose about 1% of our muscle mass per year if we do not exercise. So you can imagine by the time we reach the age of 80, we have lost almost 50% of our muscle mass. Now, it usually will not be a problem, but this process is accelerated in patients with diabetes. So this is why it is of utmost importance that resistance training or strength training becomes part of a comprehensive exercise program. And this is where we need to understand that muscle has a very important role in metabolic disease. Now, I will bring you to this graph here. There were a lot of things I wanted to discuss, but because of time constraints, I will just focus on the metabolic adaptations that take place in the muscle as a result of exercise. Now, if you look at the left side of your screen, when we exercise, we have, in the acute phase, we have two responses. The first is the period when we are exercising, and the second is the period after the exercise. So together, this is known as the acute phase. Now, what you can see is during the acute phase, there will be increase in your glucose uptake. And after the exercise phase, that gradually diminishes. With regards to the insulin sensitivity, you can see that during the exercise itself, there is no change, but after the exercise, in fact, it can last for a few hours to perhaps a day or two. You can see there's a gradual increase in the insulin sensitivity, which then plateaus and reaches the baseline again. Now, in diabetes, we all know that there is impairment of the insulin-stimulated glucose uptake, but the exercise-stimulated glucose uptake response remains intact. So this is why we really need to ensure we perform exercise as a means to assist with our glucose regulation. Now, this is regarding the acute effect, but for the chronic effect, if you can see, with each subsequent repetition of the acute exercise, there is increase in the insulin sensitivity over time, along with all the metabolic adaptations. So this is why we really need to pay attention to the exercises that involve strengthening in an effort to enhance the metabolic adaptations in the muscle. So now, during Ramadan, there are a lot of challenges to exercise. One being the inability to refuel and rehydrate during the day. Now, this rehydration, the reason why I highlighted it is because it's a very important aspect when it comes to exercise. In fact, absence of fluid has a bigger impact on exercise than absence of food, simply because we have a large store of energy, whereas when it comes to fluids, we don't really have. So that's why it's important to rehydrate adequately. And of course, the altered sleeping patterns, which may contribute to daytime sleepiness, the dietary changes, and if Ramadan occurs during the hot summer months, the hot temperatures and humidity may also be a barrier, and the general feeling of lethargy and perhaps fear of hypoglycemia as well. And as with type 1 diabetes mostly, there will be difficulty with their blood glucose management. Now, so what if some patients decide to stop exercising for this month? You know, in our exercise clinic, we've had patients who they will, even before the start of the session, they will say that, you know, they plan not to exercise for that month. But the truth is, even if they do that, most patients, I realize, it's not just that 1 month that they stop exercising, it's even beyond that in the month of Shawwal that they continue their non-exercising, not to exercise. So we need to look at this as perhaps more than 4 weeks of not training. So what exactly will happen? Now, remember I mentioned just now about the adaptations that occur. Now, those adaptations take place once we've been consistently exercising for 6 to 12 weeks. But if we were to stop exercising for 1 month, there will be regression in quite a bit of the adaptations that have taken place. In terms of our aerobic capacity, that will, after about 2 weeks, it will tend to decrease. And likewise for our metabolic adaptations. Previously, with regular exercise, there would have been a shift towards higher reliance on fat as a substrate, but now it regresses or reverts back to a higher reliance on carbohydrates. But the worst to take the hit is actually our insulin sensitivity, because the GLUT4 receptors will reduce by about 20 to 30% with just 1 week of not training. And along with that, there will be decrease in muscle glycogen, because one of the long-term adaptations when we exercise is increase in the muscle capability to store muscle glycogen. So if you see it in the muscle itself, there will be reduced cross-sectional area, meaning there's loss of muscle mass, loss of strength, and loss of the enzyme or reduced enzyme activity. So if you look at all these regressions that occur as a result of not exercising for 1 month or even more, is a reason why we should try to advise our patients to keep at least minimally active during the month of Ramadan, provided it is safe for them, which I will touch on later. Now, so what happens when a diabetic patient exercises in a fasted state? Now, when we exercise in a fasted state, our body, because we would have depleted our liver glycogen reserves, so our body will tend to rely more on our fats. So there will be increased rate of lipolysis, leading to increased ketone productions. And especially in type 1, they will tend to have hyperglycemia if they do not administer enough insulin. Another factor I would like to discuss is the increased risk of dehydration. Of course, because of lack of fluid intake during the day hours, and certain medications like SGLT2 inhibitors uncontrolled diabetes itself will cause an osmotic diuresis. And if you were to exercise on top of that, the loss of fluid through sweating. Now, dehydration can have a very severe impact on your exercise performance in normal individuals, but more so in diabetic patients because it can lead to further increase in their blood glucose levels because of the release of counter-regulatory hormones. And it will affect thermoregulation as well, which will affect particularly those living in hot, humid countries. And as you know, with dehydration, the risk of acute cardiac events, stroke happening is also higher. Okay, this has been quite well researched, and there's a lot of information that that dehydration is a potentially serious contributing factor to these problems. And of course, as you know, with increased ketones, hyperglycemia, the patient will be prone to DKA, especially in type 1. Now, with regards to the main exercise-induced adverse events, now these are the main ones that we are quite concerned about: the cardiac events occurring, hypoglycemia, hyperglycemia, heat illnesses, like I mentioned earlier, which in patients who are dehydrated, especially, they are more predisposed. Now, there are certain factors which can actually predispose towards these events. So that's why during the pre-Ramadan screening, it is a good idea to actually do a pre-exercise screening as well to identify the predisposing factors that may predispose these individuals to these events, adverse events. Okay, so this is important because the whole aim of exercise prescription is to ensure the patient does it in a safe manner. There's no point doing exercise and then the patient experiencing some adverse event which leads to morbidity or even worse, mortality. So that's why the whole idea is to ensure safety. So this pre-Ramadan assessment will need to include a pre-exercise screening, especially if the patient has a lot of risk factors. Now, so what some tips for exercise during the month of Ramadan? Firstly, that has already been mentioned just now, we need to avoid high intensity or unaccustomed exercise. Now, I want to stress this because high intensity, yes, we need to avoid, but we also need to avoid unaccustomed, meaning it may not necessarily be high intensity. It may even be just probably light to moderate or probably moderate. But for that particular individual, that moderate intensity exercise will constitute unaccustomed exercise and can act as a trigger as well. So that's why we need to read it together, this high intensity as well as unaccustomed, because what may be moderate intensity and tolerable for me may be unaccustomed activity for someone else of similar age and lifestyle as mine. So that's why we need to to emphasize that, because Ramadan is not the time for us to initiate anything new. Now, of course, number 2, do not exercise in hot weather. 3, the hydration. Now, it's very, very important. I need to stress this again, that hydration is very important. And the only time we can hydrate is between the non-fasting hours. And we need to drink at least, a lot of the studies have shown that we need to drink anywhere between 8 to 12 glasses of water to properly rehydrate and prepare ourselves for the next day. Now, this is going to be a challenge because even like in clinic, when I ask my patients, many of them don't take more than 5 to 6, and that 5 to 6 includes coffee or tea. So in fact, coffee or tea is definitely not advised because that is a diuretic. So the actual volume of fluid or water is actually much lesser. And this is very important because I already stressed earlier on the importance or the adverse events of dehydration. So we need to look into that. And of course, other exercises like plyometrics, speed, agility training can be avoided during this month. Now, if you are doing resistance training, which is definitely advisable for all diabetic patients, they just need to ensure they have a longer rest period between the sets. Now, how much exercise can the individual do depends on their physical activity levels before Ramadan. Now, if they are sedentary and physically inactive, now because Ramadan being a holy month, it may also be a month where they feel that it's the right time to make some positive changes to their life. So they may decide they may want to start being physically active, which is actually a good thing. The only thing we need to advise them, it's okay, but just go low, start low and go slow. And importantly is to be active every day. Now, if they have already been exercising, then they can continue with their current levels and aim for maintenance or to drop, because Ramadan is not the time for you to progress your exercise. You do whatever you have been doing, you can maintain that or even drop. It doesn't matter, but it's not a time to progress. When I say progress, it includes both progress during your resistance exercise, like increasing the weights or increasing the number of repetitions that they're doing, or even for the aerobic exercise sessions where, increasing either the duration of the exercise or increasing in terms of intensity. So these are some of the things that they need to look into. Now, for type 1 especially, like we all know, it's actually not advisable to fast, and more so not advisable to fast and exercise because of the they are prone to hypoglycemia and hyperglycemia. So for them, you really need to closely monitor them, because you need to balance between their food, their medication, their insulin regimes. So it is a bit more complicated. Now, for those who feel that they are able to perform, one good suggestion will be for them to actually complete a period or a session of resistance training prior to the aerobic training, because when you do resistance training, it tends to increase your blood glucose level, and that will mitigate the hypoglycemia that may occur after your aerobic training. But monitoring blood glucose level is very essential, and if for those who are not monitoring, I would strongly advise against initiating an exercise program without being able to monitor their blood glucose level, and I think this was already even emphasized by the earlier speakers. Now, of course, if you're taking the short-acting insulin doses, the doses will have to be reduced, especially during the peak time. Now, when will be the ideal time for them to exercise? Now, there is a study done by Farouk et al. This was based in Qatar. It was a retrospective study done over a period of 6 years. And it included both the fasters and the non-fasters, presumably the non-Muslims who are non-fasters. So just looking at the blue bar, the fasters, we can see that the preferred time was the evening after the iftar meal, followed by before the iftar meal. But the least common was, of course, the afternoon meal. Exercising during the afternoon session. So this really depends on personal preference. The reason being, there are advantages and disadvantages to consider for each exercise session done at different times of the day. Now, for example, if we were to look at this, now, most of the suggestions to perform exercise centers around our meals. It's not at some random time of the day, but rather closely related to our meal times. So the first option is to do it before iftar, maybe an hour or so. So that is quite a good option, because you are able to refuel right after the session. The second option is to do it after iftar, which is an ideal timing actually, because you can fuel and hydrate before and after exercise. But this is not directly after the iftar meal. Basically, you have to drink, take a carbohydrate snack, exercise, and then only have your main iftar meal. But the disadvantage with this is, because after iftar you have your tarawih prayers, and then you may gather with friends, relatives. So it leads to reduced nighttime sleep. And we know that nighttime sleep also plays a very important role in our glucose metabolism. Now, this is after the tarawih prayers, but this again is a good option because you have given time for your food to digest. But the disadvantage is, again, it is eating into your nighttime sleep. Now, the other option is doing it before sahur. Now, this is good because we can drink before the exercise, and after the exercise we can refuel back and rehydrate back. But again, the disadvantage is reduced nighttime sleep. So it all depends on what time we slept at night. And the last option is after sahur, which is you have already had refuel, but here there's a serious risk of dehydration because you have got no opportunity to refuel until iftar. So, but as for your resistance exercise, that can pretty much be done any time of the day. So it doesn't necessarily have to be tied to the meals. So in conclusion, it's advisable for diabetic patients to remain active because you know that being active helps very much in their glucose metabolism, and but it has to be safe for them. Now, avoid prolonged periods of sedentariness. As with any metabolic disease, sitting for prolonged periods of time should be discouraged. So the usual advice for, every 30 minutes to get up and move still applies during this month. Avoid vigorous or unaccustomed activity, which I'm just highlighting again. Hydration, very, very important. You have to hydrate adequately during the non-fasting hours to the tune of 8 to 12 glasses during the night. Now, we cannot just suddenly, during iftar, break fast with 4 glasses of water and then again, sahur for, because you will just probably run to the toilet and lose out on the benefit. This has to be done in a phased manner, meaning you can hydrate every half an hour with 1 glass of water. So then, it is a bit tricky, but basically that's how it's been suggested to do, that every half an hour you take 1 glass of water. But of course, at iftar, you'll probably be taking more, and then subsequently half an hour until you sleep, and then again at sahur. So in this way, at least we manage to keep ourselves hydrated. This is very, very important for those who are exercising and even for the diabetic patients as well. And if they're feeling lethargic, at least they could perform strengthening exercise. Remember, I showed you the clock. So at least they will derive some benefits, because strength training, resistance training and aerobic exercise has been proven to be almost equally effective in improving our cardiometabolic risk factors. So if they can't do aerobic, at least advise to do strengthening. And of course, if they have any adverse symptoms, to terminate exercise. And consideration of exercise timing is with respect to their convenience and safety. Okay, these were my references. Thank you very much. That's all from me.